Krillin came to us a couple of months ago, and he was extremely ill. So we hospitalized him for a little bit and quickly found out that he had heart disease. And we started him on heart medication. After that, we actually sent him for a cardiac consult with a cardiologist, and ultimately that cardiologist discovered that Krillin had a heart defect that he was born with that is not operable. So ultimately there is no operation that Krillin can have to slow down or reverse the heart disease he's suffering from. So Krillin is in need of either what we call a hospice, foster, or adopter, and Krillin is what we call an acute hospice, which means that his prognosis is relatively short. So as of right now, his abdomen is having to be drained roughly every week, and the frequency of that will increase as he continues over time. So prognosis could be anywhere 2 weeks to, on the very best hopes, probably a couple of months. So ideally, Krillin could have a nice, calm home where he can relax on a soft bed and be loved with the short time that he has left with us. What that means for a foster adopter, PLEA would continue to care for him regardless of whether he was adopted or fostered. He would have to come to the medical clinic to have his abdomen drained on a regular basis. Like I said, right now that's about every week, and we'll likely get closer together. And he also takes oral medications to try to help with that fluid buildup and fluid in the lungs and things like that. So a foster would need to be comfortable feeding him medications just in a food meatball, and then be available to come to the clinic as needed. When the fluid in the abdomen becomes pretty close together, that it's having to be drained more frequently, that is one of the signs that we need to start evaluating quality of life. The closer those come together, the more pain he's experiencing, and the more likely that we need to start discussing that decision for him. But in the meantime, because he is a dog that's experiencing some pain, an ideal home for him would not have small children, or also would need somebody who's comfortable with the process of being a hospice foster and understanding that it's okay when that decision needs to be made. And clinic staff is available to help and discuss what constitutes that decision. In the meantime, Krillin is currently staying at the shelter, which breaks my heart that he's spending his days in a kennel when there's so few left. So anybody who has, even if you have other dogs, if you have a room that can be his to sleep comfortably, that's really where I'd like to see him go.